Are you paying a competitive wage for those doctors comparatively?
That's a great question, and because I asked the same question.
That's going to incentivize them to come over to the VA if they're getting paid the same that they're getting paid at the private hospital. You know?
Yeah, it does. But here's the issue. What we have found, there's good news, bad news. Okay, good news is for like your general physicians, your primary care physicians, your psychology, a lot of our, some of our specialties, we pay at or better than the community.
Okay.
Across the board, across the country. So if you're watching and you're a doctor who's coming out of med school now and you want to work for the VA and you're a general prac,
we got a job for you.
Internist, come now.
Yeah.
We'll hire you today and we're going to pay you better and we're going to give you better benefits. But cardiology, specialty, hand, feet, orthopedics, stuff like that, we're not close. Okay. We're working on that. We've got a couple of ways we think we can get better.
Yeah.
But we're just not close.
Why do you think that is?
Because over time we've never adjusted our pay scale. There's also an issue that you can't be paid more. There's a federal rule on caps on how much we can pay.
Okay.
Can't go above a certain gentleman. And there's a pay scale here.
Yeah. That's probably part of the bureaucracy that just got put into place years ago.
Well, it's why you don't see. Again, it's all across. It's not just VA, but with us, it's more in particular because we're hiring cardiologists and stuff like that. Now, there's ways we can help with incentive pay and these kind of things, but it still puts us. It would be a lot of money for us to all of a sudden say, okay, now all our cardiologists are going to basically be on par with the community. It would be a huge budget hit to do it all at once. So we're looking at ways to do that. Yeah. So nurses, same way. And in some of our VA stuff, we use an older health records management system, which should have been replaced or been almost done replacing now, except we've ended up in the past almost 8 to 10 years, have wasted almost $14 billion on a health record management system that is only operable in 6 locations right now. And most of those 6 locations, because we decided that we were going to let everybody do what they wanted to do, are basically inoperable and don't talk to each other. They were told to centralize payroll, save money, efficiency, and cost. If you want to. Basically was the way it was put.
So they did it in some VAs and not all of them?
Over 60 locations were still doing their own payroll. So we had almost 230 that were centralized, almost 250, 60s were still out. And of course, we're fixing that.
You're trying to make it streamlined across the whole thing. So now it's just simpler across
things. So you know where you're at. So let me put that in perspective. So now we at least started having a number of how many people we had.
Yeah.
I'm from the military. I mean, my last job assignment in the military was I was the IMA to the deputy command chaplain down at Afric for chaplain's office. So all of Air Force chaplains, okay, reserve chaplains. They just told me this is the dumbest thing I've ever heard of. Fix it.
Yeah.
And we fix it, or we start the process of getting it fixed. An example of that was for the folks down in Tampa, you have Bay Pines, you have Tampa, relatively close together. Great places, good hospitals. What's the one thing Tampa typically, hopefully this year we won't have it, it's been good so far, they typically have hurricanes.
Yeah.
Okay, they had in the last few years, Tampa's gotten hit several times.
Yeah.
We found out, this is just a small example, but we found out that one of the doctors finally said, I have an issue. And I said, what is it? He said, why is it that when I go from Bay Pines to Tampa, where he actually worked, we had to transfer patients or doctors during a hurricane, that it took upwards of 2 or 3 days to do the processing to do quote credentialing and privileging to get a VA doctor into another VA facility less than 20 miles apart.
Because it was such a complicated process of doing that?
Yeah, we had made it so hard that it would do this. I said, that's the dumbest thing I've ever heard.
Yeah.
So we've now made it applicable where if I wanted to take a doctor in Tampa and move them to Seattle tomorrow, before they could even get their go home and get their backpack, we'll already have them privileged at the other place. If you work for the VA, you're going to be at the VA.
What did you do to fix that?
We went back in the internal system and we said, dude, this is stupid.
Okay.
He said, you're a VA employee. You're already there.
Yeah.
Why are we doing this? And so it just took some changing paperwork. It took changing a thought.
Paperwork.
It took the click. It was now no longer that the toilet was okay running by jiggling the handle.
Yeah.
It was no, we're going to do this and get it forward. And now you have doctors and we've talked to nurses, doctors across there. Wow, why didn't we do this before?
Yeah.
Well, it's not because I'm a genius. I mean, I'm homely and sort of tall, dumb, and ugly. You can think about some stuff. I mean, I'm just common sense, which my grandma told me wasn't common.
Yeah.
But just use these things.